when we look at things like poverty, emotional stability, chaos, neighborhoods, schools, families, drugs, violence, all these sort of things affect your lives. I have families under stress because of this. There's the typical stress-related headaches, stomach aches, there's depression, poor sleeping, doing poorly in school. We struggle all the time with our families to provide services for them. And we sometimes reach a point where no matter what we do, we don't have enough time, we don't have enough people, or we don't have enough clout.
We bring lawyers into the community healthcare setting to work directly with patients and their families, as well as their healthcare providers, to reduce these legal barriers to health. When I first met Abraham, he was really in crisis. Abraham was experiencing a lot of anger and hopelessness and frustration at his situation, which culminated in him punching his arm through a window at school. His psychologist was very scared for him, his family was very scared for him, and his teachers were very scared for him. So he was having a lot of problems at school, and those were exacerbating his mental health crisis. So we called a meeting to put together a safety plan. What we were able to do was get the school to make changes to Abraham's IEP and other services. Abraham was moved to work with different teachers who were better trained to work with him. Once he started receiving the services that he needs, he was not getting in fights. He was passing his classes. He's really done an absolute 180. For us to see him so focused on being successful in school has been wonderful to see. In looking to expand the program, we looked around MetroHealth to see what are the communities of particular need. And so we are expanding into Spanish-speaking and other recent immigrant communities in Cleveland. We're expanding to the reentry community, and we're also expanding to the elderly.
Initially, many we see are in shelters. Housing obviously is an issue. Well, let's see. We met a gentleman actually on Monday who had just been released. He has multiple medical problems, and he had no way of getting his medication. In the past, many of these folks, they were not aware of what was out there on a legal basis as far as the disability or applying for SSI or doing things like that. Whereas an attorney who's used to dealing with this population would know them and can help them. And again, it was hard to find someone who would take the time and interest in their cases to try to help them see what their legal options were. Instead of trying to piecemeal it together, now we have a program where I have these tools readily available. Now he has his own doctor, his own medical home, he has a way to get his medications, so he has an opportunity for a very smooth transition from being incarcerated.
I think that a lot of people are surprised to hear that lawyers can have such a lasting impression on patient health. But as an attorney, we really are able to make positive, lasting, ongoing changes for the families with whom we work, and the partnerships that we have with the medical providers make us more effective at our job.